Thank you, and good afternoon. We have a couple positive updates to share on a couple different things. Since the very beginning of confronting the coronavirus pandemic and outbreak, we've talked a lot about the need to help and protect our vulnerable populations. We know our senior citizens are particularly at risk from the impacts of coronavirus, and we know that a lot of them do have underlying health conditions. We've asked them to quarantine even more than the general public, and that's created great challenges and difficulties. But as Dr. Wilma Wooten stated yesterday, their lives are no less valuable than someone else's life. And so we have to continue to take proactive steps to make sure that we are supporting, helping, aiding, and assisting both those with underlying health conditions as well as our seniors who are out there who in many instances are struggling from a number of challenges, both in terms of isolation and anxiety and concern, but certainly the availability of reliable quality food is a very important component of ensuring their overall health. A number of years ago, I sat on a plane next to a longevity expert who studied people who lived into their hundreds, and I said, well, what is the secret? And he said all of those individuals generally had things in common. They had a purpose, they had companionship, they stayed active, and he said they ate a good, healthy diet. And so today I'm pleased to announce that we are moving forward with our adoption of the Great Plates Delivered Home Meals for Senior program. This is a partnership with Governor Gavin Newsom and the state of California to bring this program to San Diego County. A committee including representatives from the county's aging and independent services teams and selected local restaurants are joining forces to select restaurants that can participate in this program. In order to participate, the restaurants needed to be able to meet both the volume and the nutritional standards. They needed to use local produce and meats. They had to prioritize local worker retention. Now that we have the restaurants signed up, we are ready to launch this program. It will immensely help seniors who are at home, who are under the stay-at-home orders. And so starting today, older adults in San Diego County can apply. Now, before we get to the information about how to apply, it is important to point out that this program is intended to fill a gap for seniors who are not currently able to access other feeding programs. And so this program is only available for seniors who are not currently receiving or eligible for other federal nutrition programs such as CalFresh or the Senior Nutrition Program. So if you're a senior who is not already receiving federal assistance program, then the Great Plates Delivered Home Meals for Seniors is for you. We have a slide here to talk about how you will sign up for this. This program delivers 3 free meals a day delivered to you. Again, you see the qualifications seniors not receiving or eligible for programs such as CalFresh or Senior Nutrition Program. And you see the sign-up details there, the website, aging.sandiegocounty.gov/greatplates, the phone number 800-339-4661 and press 7, or you can always call 211 for help and assistance. Capacity is limited to this program, so we encourage you to apply soon. We expect this program to run at least through June 10th, and then we will see the status of if it's able to be extended or not extended. This is not only a great program for our seniors, but this is a great way for us to continue to engage and support our San Diego County restaurants who are struggling during this difficult time. And so we're grateful to our restaurant partners, to our staff in aging and independent services who helped pull this together, and of course to the governor and the state of California for launching this program. Quick update on testing at the convention center. 19 more tests have been performed from yesterday, 11 residents, 8 staff. There's still no change in the results. There's a little bit of lag in getting the results, but we will share those with you as we get them back. I also wanted to share, you may have seen, I believe, the Air Force put out a notification, but tomorrow the U.S. Air Force Thunderbirds will be performing flyover tributes to our healthcare workers at our area hospitals. This will be taking place around noon. So around noon, if you look in the skies of San Diego at various San Diego hospitals, you may see 6 U.S. Air Force Thunderbirds flying a little lower than they normally do. And it is a great tribute to our healthcare workers and a reminder to us all that despite the challenges and the difficulties that so many of us face, our healthcare workers remain on the front lines. They show up to work, they treat individuals who are not only suffering from coronavirus, but everything else out there. And so it's a wonderful way to honor and pay testament and treatment to those healthcare workers and express our appreciation and gratitude. And they're really cool to see 6 of these flying in formation really low. So if you have a chance, don't go to a hospital and congregate. Don't congregate anywhere, but if you look in the San Diego skies around noon tomorrow, you ought to be able to get a good look at them. We have not been updating on a daily basis. We've been updating on a daily basis. We have not been sharing on a daily basis the personal protective equipment slide that we were using for quite a while, but I did want to highlight a couple milestones here. We've now surpassed 3.8 million individual items of personal protective equipment that's been distributed. That includes more than 1 million N95 respirators, more than 1 million gloves, along with more than 1.5 million face masks. There is an entire team here at the county that works tirelessly 7 days a week to find every possible supply chain where we can acquire personal protective equipment, whether that's through the state or federal government acquiring it on our own, partnering with area churches on repairing things, taking donations and processing them and making them available. They are doing incredible work and literally moving millions and millions of items on a daily basis, and we appreciate their efforts and their support, as do, I know, our area healthcare systems and others that have received this personal protective equipment, and that work will continue as personal protective equipment is going to be a part of our daily work as we progress all the way through the coronavirus pandemic. Jumping into our T3, we had a big jump in testing today. We got really, really close to the 4,000 number for the time being. I wish we could have just found 2 more people to get to 4,000, but we are pleased to report our single highest day total in testing, 3,998 individuals tested. Again, we're going to see day-to-day fluctuations. You're going to see numbers go up. You're going to see numbers go down. We know that we have a lag coming out of the weekends, but this does reflect the ongoing commitment and effort to see a sustained upward stepping of our testing, not capacity, our testing being actually completed and done. We're also creeping up soon in the coming days to where we will hit over 100,000 total tests reported. 171 tracers. Those are folks who are out, trained, staffed, working. We have a whole group of them that are in the onboarding and training process, and so we expect this number to continue to jump. And these 2 numbers, again, go together and provide a vital foundation of our ongoing efforts as we open up the ability to rapidly and widely test, identify positives, isolate them, contact trace their close contacts, test those individuals, and those efforts are a part of being able to contain the spread moving forward. We're presently treating 194 individuals in our public health motel rooms for 674 total. Next, you will see today we're reporting 113 new positive test results. Again, that is out of our single highest day testing results of 3,998 for a 3% total. We continue to believe that as we continue to expand testing, that the percentage of positive will continue to go down because we are hitting a wider sampling or less dependent on those individuals who are sicker and more likely to be positive. And so continuing to see this go down is good, but is also expected as the testing goes up. Next slide is our hospital system capacity. You see ICUs up slightly there at 146. Total hospitalizations for COVID down just a little bit at 380. And again, that 380 number, when you look at that on top of those in our hospitals for non-COVID related reasons, 380 there is a part of 3,870. And you see that under the total hospital bed system capacity for our region. Lastly, we will just take a look at the cumulative positives, 5,391. Estimated recovery, 3,364. Cumulative hospitalization with the doubling rate of 30 days. Cumulative ICU, and then the unfortunate loss of life today hitting the 200 mark, which is a reminder that despite all of the actions and steps we have taken, this still is a deadly virus and disease, and had we not taken the actions and steps we've taken, we have been presented with information from UCSD. This number would now be around 13,000, and so the actions we've taken have saved lives, have given us the ability to come out of this in a smart and sustained way, and to begin to rebuild our economy. But it is a reminder that the danger is still present and still out there, which is why we ask the public's continued help in adhering to our public health orders. With that, I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report.